Welcome to the Night Health Report. I'm Lauren.
And I'm Melissa.
And tonight we're going to be reporting on substance abuse in pregnant women.
The consequences of drug abuse in pregnancy are high for both women and her child. Therefore, it's important to develop and evaluate effective treatments. Prevalence of opioid use range from 1 to 21%, and because heroin crosses the placenta, opioid-dependent women experience a 6-fold increase in maternal obstetric complications, such as low birth weight, toxemia, third trimester bleeding, fetal distress, narcotic withdrawal, as well as increased neonatal mortality. Research from the Cochrane Database of Systematic Review looked at a pharmacological maintenance against treatment for opioid-dependent women. And in that particular study, methadone, slow-release morphine, and buprenorphine were all looked at. However, there was no significant difference that allow us to conclude one treatment superior over the other. However, methadone did seem to be superior in terms of retaining patients in treatment, and those that used buprenorphine had less severe neonatal absence syndrome.
The World Health Organization conducted research that didn't make recommendations about the efficacy of which medication should be used during an opioid maintenance treatment program, but they do suggest that an opioid maintenance treatment plan take place rather than detox, as opioid relapse is more likely following detox than with opioid maintenance treatments. Pregnant patients that are opioid dependent should be advised to continue or commence with opioid maintenance therapy combined with psychosocial interventions.
And mentioned in psychosocial interventions, there was another research study from the Cochrane Database of Systematic Review that looked at home visits during pregnancy and after birth for women with alcohol and drug problems. In these 7 studies with 803 subjects that compared home visits after birth with those that did not have visits after birth from community health nurses, pediatric nurses, midwives, and lay African American women, there was no significant difference in continuing illicit drug use with or without the home visits.
The World Health Organization also recommends that healthcare providers ask all pregnant patients about their alcohol and illicit substance abuse, both past and present, as early as possible in a pregnancy and at every antenatal visit. They also recommend that healthcare providers offer a 5 to 30 minute structural therapy session, as the benefits outweigh any potential harm that could be caused by that intervention. And then research from the Joanna Briggs Institute shows that individual counseling and feedback and social support are effective in smoking cessation in pregnant women. With all the discussion of the World Health Organization research, they do admit that further research is very likely to have an important impact on confidence in the estimate of the effect and is likely to change that effect.
It is important to develop better evidence-based treatment modalities to this important population. And that is our Night Health Report. Good night.
Good night.